Here tonight, mental illness can impact anybody, but culture, race, and gender can affect access to treatment, support, and quality of care. July is Minority Mental Health Awareness Month. In tonight's Moments That Matter, Shirlene Shanklin and our photojournalist Alyssa Newton sit down with a psychotherapist working to get rid of the stigma of seeking help.
I think that anytime that anybody has a big change in their moods, it's an indicator that something's wrong.
Psychotherapist Gail Bibb explains some of the warning signs when you may need a mental health checkup.
When people are excessively worrying, extreme mood changes, highs or lows, having thoughts about suicide, or really difficulty connecting in social settings could be indicators that there is something wrong with your mental health.
There are several ways to treat patients. Bibb explains her method.
So I use a holistic approach. It's just a modality that encompasses the mental, emotional, psychological, social impacts of a person and their well-being.
Major life changes or maybe something in your past unresolved resurfaces.
And triggers are just unhealed wounds from your past. And so anything in the environment can trigger it, a smell, somebody's personality, something that someone can say to you can trigger up an emotional response.
Bibb explains why so many African Americans are so apprehensive about seeking help.
I think historically there's been a mistrust with getting services, getting adequate care that you need. Generally, I think a lot of African Americans have used the church as their provider for mental health. Particularly growing up for me, it was always whatever happened in the house stayed in the house.
Bibb has obtained 3 master's degrees, but not because of the science, but her own personal connection.
I grew up and I didn't really have a relationship with my biological parents. And one of the reasons is because my biological mother was diagnosed with bipolar and schizophrenic. And so I think that my interest was sparked because of my own traumas that I've grew up with.
Bibb explains why so many blacks choose their faith to help them instead of medical assistance.
It has been the outlet that we have had with no stigma. And so it's always been something that we could go kind of cry with no shame, shout, right? And really have emotional expression that wasn't demonized.
She tells her clients of faith that it's okay to seek medical help.
Prayer is a weapon, but therapy is a strategy, and we need both. To be the very best versions of ourselves, I think that when you really lean in on your faith, it really gives you a level of resiliency. But it doesn't allow you to process the things that you've actually experienced. And therapy gives you that opportunity to co-regulate with someone else that can be safe. And we can heal in safe and trusted relationships.
For Moments That Matter, I'm Shirlene Shanklin for WHAS 11 News on your side.